So when I started, my friend's a nurse. I actually started with a coach, and his name's Greg Todd. He works with physical therapists. So in my journey to become a childbirth educator virtually over social media and create a course that I could sell. And honestly, I was just looking at what are my possibilities? What are my options if I want to have a business and work for myself while getting my message out there to moms and to parents that they need to learn so much before they get into a hospital, and so much more than is just taught in a birth class, but by a nurse that has been there at the bedside, struggling. So struggling to get all the information to you when sometimes I can't. Anyways, I needed that bit of confidence boost, a little imposter syndrome hits, and some organization skills, business skills, and just learning how to give my elevator pitch in a sense. I'm still learning, you guys, obviously. But I'm taking action more than not, which is why I'm here with the Birthing Podcast, right? So in this group, anyways, I had been watching this guy on my social media, and he just everything he was saying when he said it, when he posted something, just resonated so strongly with my views on business and my time and how I want to grow both as a person, as in my family, with money, and so in a business. So I reached out to him, and he was actually starting this, group coaching business thing that week. It was like a 5-day course that I jumped in on, and here I am. Look at me now. I have a new coach. I'm still following him. I'm still consuming all of his material, but I decided to hire a different coach, Trish Ware. You probably know Labor Nurse Mama. I love her, and I'm hoping to get on her podcast soon and bring her on mine. But she's huge name, a huge influence, and a huge mentor for me. But anyways, Greg was the first. He was the one that got me off the couch. A year later, I went back and did that 5-day course again. It was free. I think I paid an upgrade just to be able to get the little perks out of it, which has you go for the perks, you guys. If you're going to do the homework, when you get a course, just go for it and try to get all you can out of that. And that goes for childbirth course as well, right? Mine's quite extensive if you get the whole program, but you're going to work directly with me. You're going to feel so confident when it comes to your birth in a hospital. So you got to do the homework. You got to show up, and you want to make it happen. And that's how you get the results. And then I can guarantee you results if you do the homework. And I'm one to do the homework. So I definitely showed up, and I came a year later with the perks and everything. And this is where I met the fantastic Dr. Joselyn Rodriguez. She came to that course as well. She has such a plethora of knowledge and experience in the pregnancy, prenatal, postnatal realm when it comes to your body, movements, your muscles, your bones, the orthopedic portion of it. And she's a specialist in her field of physical therapy. And I am so beyond happy that I was able to meet her, that I heard her on that 5-day course, and I reached out, and now we're friends. I start following her on social media, and we chat, and we developed quite a relationship and partnership. And that's what it's all about. That's a huge part of business I've found in this last year. And I've made so many friends, but I've learned so much. You guys have so many resources out there at your fingertips. You just have to speak up and learn about it. And I'm so happy I did. So I invited her on to our podcast today to interview, or I should say have a discussion. We had a discussion previously, just one-on-one without recording, and we really got into patient advocacy and your rights as a person in a hospital, and how many times those are ignored or revoked, and it crushes us, and it ends up crushing you, whether you know it or not. These like little micro traumas happen when our rights are ignored or disrespected. And so we had an amazing conversation. I just had to have her back and had to record it this time. So just a little insight, Dr. Joselyn Rodriguez has her own business, and she's a board certified orthopedic specialist. And she provides a full body approach to helping women achieve their goals and specializes in prenatal care and labor prep. You have prepare for labor, both physically, mentally, emotionally, right? And she does a lot physically, and as well as postpartum care and your overall wellness, right? She has a unique focus on pelvic floor, and she helps women assess what matters most to them and supports them in working towards their goals. She does in-person appointments, virtual coaching, specialized treatments, but she's all about helping them maximize their physical fitness, but respecting their different energy levels and healing levels and sort of meeting them where they're at. So she is dedicated to that. And she just believes that a active mom is a healthy one. And that means mentally and physically, right? So I'm so happy to have her. Honestly, this conversation, we kind of just dived right in because, of course, we're friends. So we started chatting about it, about the topics and about what was going on in my life. A lot of things kind of hitting me from all which ways, not the best sense, but how I was able to maintain some sense of balance and regulation mentally, emotionally, all of that. So we kind of dive right into that. So let's get started. Welcome to the Birthling Podcast, presented by My Friend's a Nurse. I'm your host, Colette, a high-risk labor and delivery nurse right here in sunny California. I'm also an OB certified specialist, birth educator, lactation expert, and mother of 2 beautiful daughters. I am passionate about guiding you through the miraculous journey of pregnancy and childbirth, using evidence and history and asking the reason why. I have some incredible medical friends and colleagues, and we're all here to help you navigate this often overwhelming birthing hospital system in the United States. My goal is to gain trust in birth, improve this system, and provide some valuable insights. Let's make this journey a little less daunting and a lot more joyful. Let's get into it. So anyways, we were chatting, but what I was saying was how things come and happen that are in our life. Like I was so stressed about all the to-do list that I had to get done for this business, especially, that when something so dramatic or so significant happens and it comes to your health or your family's health, and it's like one thing after another, it released so much pressure off of me to get this right. Like, this doesn't even, like, it matters to me. I don't get me that way, but in my circle, in my tight group, this is not the most important thing. So really, it slowed me down, like, mentally, but because I've been on top of my diet and my mental health during the last few weeks, I've actually been more productive in everything without the pressure of getting it right or doing everything. So that's why I brought that up, just with my husband and the medical issue going on there.
Mm-hmm.
But that's kind of private stuff, so I
silver
won't
lining.
we talked about it earlier. But let's get into it. I'm so glad that you signed on and we're here and we get to talk all about the importance of taking care of yourself, staying active, the pelvic floor, and of course, our favorite topic, advocacy and consenting to things in the hospital. Just a brief for our audience, just a brief background on you that you sent me. First of all, you just did an amazing masterclass for the members in the Birth Link, and I'm so thankful for you. They have been writing me, especially the one that attended. She loved it. So I'm excited for the new members that come on and get to watch it later on. And I just appreciate you taking that time because I learned a lot myself. So thank you.
Yay.
It was so
Pleasure.
professional and just well done. So just a little background, we have Joselyn Rodriguez on, and she's a board certified orthopedic specialist.
She provides a full body approach to helping women achieve their goals and specializes in prenatal care, labor preparation, postpartum care, and just overall wellness. And I love that you do in person, but you also do virtual consults. So it's for everyone and anyone, and that you do specialized treatments. And this allows them to really maximize their physical fitness, but also takes into account, how far they can go, their energy levels, their healing. Everyone's different how they heal. And so I know you have your own business and you're striving to get that out there. And I love I was going to pop on, like, show your last Instagram post because I really liked it, where you were just demonstrating, like, the sounds that women make. So that was cool, but I can't do anything with this computer thing right now, so I'll give you her handle. I'll give you Jocelyn's handle later, and you can go check it out. Her Instagram's great, and she shows a lot of practice.
It's 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 at the pelvic
At the
trainer.
Pelvic Trainer. Yep. Go check her out, Joselyn Rodriguez. But let's get into it. So first, tell me give me the backstory. Like, I know you're a physical therapist or orthopedic specialist, sorry, but what got you into your passion of working with women and their specifically their pelvic floor?
All right, thank you so much. I'm super excited to be talking to you about all these things pelvic floor. And so your question about why I or how I got into pelvic floor actually started in the rehab profession as an athletic trainer. And for those of you guys who don't have athletic trainers in your state on a regular basis, athletic trainers are people who work with athletes with teams. And once I decided that I wanted to work more autonomously and be able to work with more populations, I decided to go to PT school. I went to PT school, and in my last rotation, we decided to get pregnant. And when I sat for boards, I was 37 weeks pregnant, perfect timing, sat for boards, went into delivery and thinking that I was this hot PT who knew about her body, and then realized, uh-oh, I don't know about this stuff. And luckily, when I decided to get into the workforce, I worked at a hospital who had a significant pelvic floor department. And I learned about what it was. And I was curious, but it wasn't until someone who's a pelvic floor therapist said, hey, Jocelyn, you would be really good at this. I think you should, consider this as something that you specialize in. And I was like, okay, I'll dip my toe in. I took a course just to see, can I do this? It's not for everybody, right? And so I did my first course and I was like, I really like this. I really like helping people, men and women, address pelvic floor dysfunction. But my passion lies in helping moms because I remember being in on the floor in labor delivery, acutely postpartum, asking for help, asking for this and not getting it. I asked for a lactation consultant, didn't get to see them. I asked for the pelvic floor therapist, didn't get to see them. And so this is definitely an area of care that is being ignored. As women, we are undervalued, we are under researched, and I want to provide this care so that everyone can take better care of themselves and have an exceptional postpartum experience.
I am such a novice. All right, cool. I was just saying to myself that how our own experiences just can really drive um, a new understanding for what's missing out there or our own passions. And yeah, I love that. So let's dive into more about your career or what you have seen, the most common things, especially when it comes to our audience, mostly pregnant women or expecting parents, or those just like very curious about birth, right? That's how I
Yeah.
started. But so give me some, maybe the highs and the lows of being up in this pelvic floor space. Like what just like sets you up? Like, this has been an amazing day, or what? And what can really just be like, dang, like, why does it have to go? Or even to the point that you wouldn't want to quit, right? We all feel that in any career. What would you say? Maybe you could pick one or two.
Yeah. I think that the hardest part sometimes is when it's difficult for people to prioritize their own health, whether it is external pressure or the pressures they're putting on themselves and prioritizing other things. Sometimes as a mom, especially, you can feel like you have to, like everyone else, and everyone else's needs are more important. But we have to remember that as moms and as women, we are the glue. And if we are not okay, then nothing else is cohesive, right? So that's some of the hardest part. Some of the highs is when things like simple things like, I can poop regularly. Think people don't think about things like that. Sometimes people have like significant trouble with defecation, or someone has significant trouble with intercourse and they can't enjoy intercourse. Some of those things are amazing when someone comes back and says, "Hey, I've pooped daily and it hasn't been difficult," or "I had sex for the first time without pain and I had a wonderful orgasm." I'm like, yes, that is amazing.
Love that. I remember in the master class, you brought up pooping and that so many people are doing it wrong. I'm like, oh, oh, oh crap. No, no pun. But I was like, am I? I'm like, okay, no, I think I got this. But then it made me reevaluate how I'm teaching my daughter, right? Because she's 3. So she struggles sometimes with like being all the red face and pushing and putting all this pressure and crying and painful because little kids sometimes they get constipated with some of the things they eat, and then it transfers of course over to like push, like you're pooping and you're, if you don't know how to poop, how are you going to push? So it's a level of understanding, and you don't know what you don't know. You think you're doing it the right, and then someone just tells you, just push like you poop. I'm like, yeah, I have a hard time pooping. And then also, that's not necessarily true. You want to, you kind of want to do things a little different than when you're pooping. So I've kind of steered away from even saying that.
Yeah. Yeah. But a lot of that, because a lot of times people are pooping incorrectly, and that's resulting in hemorrhoids. How many pregnant moms are having hemorrhoids because of constipation, right? And so you tell them to do the same thing they do when they're pooping, they're likely not going to do it right.
Exactly. Like, so what about, I mean, we're bringing this up. Give me a tip. Give me a tip or two on how to poop right.
Yeah.
Since you mentioned it.
So one of the biggest issues I see is that people, and this started when they were younger, they hold their breath while they poop. And when they bear down to poop, you should be exhaling. The exhale is going to make the pelvic floor more pliable, so that so that the anus opens up nice and easy, right? If you hold your breath, it's going to make it harder for it to relax and let things through. So I like to pretend, especially with little kids, pretend you're blowing a candle as you bear down, right? Or pretend that you are blowing bubbles as you bear down. And you should feel like your pelvic floor should be completely relaxed. You shouldn't be squeezing anything while you're pooping. Everything is relaxed
Yeah,
down there.
we'll stay away from the word strain. And like you're straining, you're struggling to push this thing out, but it's more relax, breathe out. And that goes right into pushing a baby out, right? The vagina is not the rectum, but it is using still the pelvic floor. We want to minimize tearing down there, and the more strain and the more tight we are, then the higher risk we are to severely tear, right? We may tear a little.
Not only that, yeah, but not only that, in general, if a woman has significant tension, even before pregnancy, she gets into pregnancy, continues to have this tension, in my opinion, I think that can lead to difficulty with the baby getting through the birth canal and having the risk of increased likelihood for C-section. That baby can't come down.
100%. And then most of these women have no idea that they're straining or that they're tight before they get pregnant. They work out, they eat well, in their heads, no, I'm fine, I'm healthy, I can do this. And then they're, using their old habits or just how their body is set up, and they're gonna struggle. So then that leads me to ask, like, when should everyone come see a pelvic floor specialist, like before they're pregnant, or when they're pregnant, and how do they get their doctor on board with that to to get them a referral, or can they just go on their own? And like, when would be a good time, especially if you're trying to get pregnant?
Yeah. In an ideal world, every person, man or woman, would see a pelvic floor physical therapist at the very least once in their lifetime and not wait until there's a problem. Because like you said, majority of us are pooping, or like I said earlier, majority of us are pooping wrong. And how many things could we avoid if we just had the proper education? In pregnancy, absolutely seeing someone before you're considering the becoming pregnant would be good because you can make sure you're preparing your pelvic floor to, be able to carry and support your growing uterus with your baby in it, right? And then in pregnancy, you should definitely go see a pelvic floor therapist to make sure that you're keeping everything nice and strong, not just your pelvic floor, your hips, your back, your core. All this, a healthier mom going into delivery is going to make for a healthier delivery and healthier postpartum period. And so all these things kind of set you up for optimal, situations, so optimal health, making sure you have good cardiovascular endurance to maintain the delivery is so important. Nobody thinks about that. People think you can go into the marathon of delivery for, maybe 20 plus hours and not get fatigued or not feel the effects of it. And, how many people have significant upper extremity weakness and then they go into delivery, they want to be on all fours, but you didn't practice it. What do you expect? You have to prepare for every, stage, whether it's pre-pregnancy, prenatal, and postpartum. You have to prepare. The stronger you are going in, the stronger you'll be after.
Definitely. I see more times than not the anxiety of the pain. Oh, I'm gonna feel these contraction brains, and breathing is good. So to get through that, and I want an epidural and all of that. But for most of the patients that I labor with, and now clients, what they're missing is, one, the preparation that goes into it beforehand when it comes to a whole body preparation. Like, and it doesn't have to be heavy weights at the gym, but it's a combination and balance of strengthening and stretching, and learning and using, of course, your breath in there and proper techniques so that you're not hurting yourself both while you're prepping and then also in delivery. And you're right, like the cardio that goes into it. There was an app that I used while I was pregnant, and it basically it's like a hit exercise that makes you, for like 30 to 45 seconds straight, just getting your heart rate up, and then a breathing exercise in between for 2 minutes. And you do that for like 30 minutes if you can build up to it. But I'm laboring with women for hours and hours in active labor, right? I couldn't even do it. I was I was
Yeah.
pregnant and I was trying to practice it, and I'm like, screw this. This is hard and I don't like it because it's really, really difficult. So then you need to really focus then, okay, well, if you don't like the cardio part of it, strength training, building that upper body, and which you're going to be able to use after as well, right? Into newborn stage, and building your core and your back is so important. Like, they're just thinking pelvic floor, which is very important because that's the main stage. But you can't do the whole show without the rest of the crew and the background and the backstage and the audience. And that means everything from your mental, like being mentally ready, your breathing ready, your strength training, your upper body. I think I mentioned planks, but you said that was, you want to be careful with the pulling of the muscles on that, the diastasis recti. So you want to adjust those for and adjust these exercises and work with someone like a physical therapist, or if you have a personal trainer, make sure they're specialized in prenatal and postpartum, because a lot of the exercise we can't do because it really does make our abdominal, the center, those muscles worse, and we think we're getting them better. So it's a lot that goes into it to really be prepared and then to recover better afterwards, because it's not, we talk a lot about birth, but a lot of it's just a recovery and setting ourselves up, right? So then
Yeah.
what would you say? Like,
That's
what are the most three, like, I'll just put three, but you can give me whatever. Like, common complaints that you see from women, maybe postpartum, that they wish they had done or that you wish they had done. Like, what are the most common complaints? And then we can give some tips on how to, are they preventable? And I mean, I feel like you touched on it a bit, but
yeah. 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 So a lot of times women don't make the connection that they could have done. A lot of times after their issue, and they don't make the connection that that there's something that they could have done for it. They just come, because in America, that's what we do. We don't do preventative care. We respond to injury and trauma. And so that's the expectation. You have a problem, okay, now go see someone. So a lot of times I'll see people for, if they have a pelvic organ prolapse, they have the diastasis recti, painful intercourse because of a tear they had, and now they can't enjoy intercourse. SI joint pain, back pain, feelings just of instability overall in the pelvis. And again, if you get on board beforehand with someone, working to keep you strong, then a lot of that can be mitigated. But to go back to, I didn't answer one of your questions about the referral to see a pelvic floor therapist. Yeah, I want to make sure I answer that because that's an important one. In the majority of states, there is direct access, so you don't absolutely need a prescription to start physical therapy. Your insurance may require it if you're going through your insurance, but that's something you have to ask your insurance. As far as talking to your physician and what you should say, if it's usually the only restriction is that postpartum phase for that 6 weeks before you get cleared for internal work or for intercourse. But of course, there are other things as a physical therapist that we can address. Like if you're having back pain from breastfeeding, we can address the back pain, shoulder pain, that diastasis recti, symptoms of prolapse and pressure vaginally. We can do so much before we even consider doing an internal assessment. And so really, you could go at any point. You just have to contact the provider you want to see and ask them, okay, what do you need? What do we need to move forward? And they'll let you know.
right. And I've learned over my years to, like, don't settle for it's normal. It's normal. The pain's normal. Oh, you're peeing your pants when you laugh. It's sorry, you just had three babies. That's your life now. Here's some Depends. You're like, What?" you know, because they just don't have the answers themselves, but they like
Mhm.
most providers need to know better that if they don't have the answers, someone should have the answers. And I'm so glad that nowadays we have the internet and we have social media and we have this platform that we can share our knowledge, and that pelvic floor therapy has become a thing, at least for me, that I have seen now more, that has become more popular, I'm losing the word, but people just know it exists. I hope. But still, so many patients that I'm laboring with have no idea. And I'm about to push with them and they're like, "Oh, I could have done that," or "What are you talking about?" I was like, "Oh man."
Right. Yeah. Yeah. I actually had a client come to me after her doula, which was my doula referred her to me, said that during her first delivery, when they told her to push, the baby's head was going back into her body. So she was doing it. She was contracting. So we had worked on that for her second, no issues. Baby was not going back. Baby was not hitting the reverse button. They were going the right way after she had learned how to properly perform and coordinate the push.
Pushing is such a huge thing. I was trained one way and one way only in the hospital. This is how I saw doctors pushing. This is how I saw the other nurses pushing. So, of course, that's how I became really good at instructing and coaching until I took it upon myself to learn better. And it was just that purple pushing. You're holding your breath for 10 seconds while you just grab your legs, bear down, curl up into a ball, chin to your chest, and we count to 10. And then you relax for a split second and you get right back into it. And then you do it three sets, and then you get a minute to rest. And these women were exhausted. Baby's heart rate was dropping. Sometimes they were so tense, and we would always make sure, like, no, you're tensing your legs. You're too tense. You got to relax, relax, relax. It's so many things in their head all at once. It's like, wait, what? Chin to my chest, hold my legs, hold my breath, push as hard as I can, but relax. I was like, what? What? And then the baby would just be like hanging out there. And it wasn't until later that I'm like, stop everything. Just stop. I'm like, look, we need to reevaluate. Your uterus is so strong and it is doing what it needs to do to push this baby down. And your baby is turning and molding. You just get into that right position and breathe properly. Don't push because the baby's going up with your pushes. So something's wrong. Let's stop. And then she would relax. Sometimes at that point, they could laugh the baby out. They could, and this is epidural, right? There's not much coaching I need to do for a woman without an epidural. She's like, back up. This baby's coming. Once in a while, you need to breathe, or let's maybe get into a better position. You look like you're in agony. It's because they're lost sometimes and they need a little bit of guidance. But it's mostly the ones that have an epidural where they're just, am I doing it right? Am I doing it right? And no, the baby's not coming down. You've been pushing for 3 hours, and so now we're gonna have a C-section. And we're like, no, right? Or they're pushing with too much force and the baby does come out, but everything's so tense down there that now they have a 3rd-degree tear that takes an hour to repair, which cuts into, not only, let's not even get into recovering from that and the trauma from that, but that's time that you should be spending cuddling with your baby and could have been prevented. We can't always prevent that, but if it has to do with the way you're pushing, then yeah, possibly you could. And I tell all my clients now, go see a pelvic floor therapist before to get a baseline and then get tips on this and practice with them, especially if your doctor's telling you your baby's too big or your pelvis is too small. They can't diagnose that. You need a proper evaluation from a specialist to really tell you that your hips, plus everything changes once you're in labor. So even that you can't properly, you have to give it a go, right? You got to give yourself and the tools.
Your joints are lax for a reason in pregnancy, right? It's preparing to create space for the baby to go through the birth canal. And so we know that the sacrum has to do significant movement to allow the baby through. And that's why we're built the way we're built. So even when someone says, "Oh, the baby's too big," it's like, really? Come on.
Right. Let's look at the big picture. Let's look at my genetics.
Yeah.
Especially when the woman's like 6 foot. I had one mom that she's like 6 foot, and they're like, your baby's too big. We're like, really? Because my mom gave birth to 3 babies and they were like all 10 pounds. And I'm pretty big and my partner's big. So how is this possible? But they kept saying it, kept getting in their head, scaring her, and she ended up with a C-section. It was pretty traumatic, but oh man, yeah, it's just a shame that I see it more and more.
Yeah, big people have big babies.
And little people can have little babies. And sometimes little people can have big babies and they handle it. You know?
Right.
They make it work. Is it fun? Not always. And then that's where you should work with your doctor. You maybe should get evaluated. Maybe you should take all the risks into consideration. And I don't knock someone that's like, actually, I'm gonna have a C-section because I'm 5'1" and my husband's 6'4" and my doctor's saying this baby's big or I have other complications and I just don't want to risk tearing things up. And you know what? That's their decision, and let's prep you then for recovery. Let's give you the tools to be able to recover from a C-section as well, because you're still going to have the issues with diastasis recti, prolapse, pain with your pelvic floor because you've been holding this big baby, right? Recovery with the incision site, and with the nerve damage that can happen. There's just like it doesn't matter how you deliver or how you're planning to. Yeah, get your support, get the resources out there, like a pelvic floor specialist to to maximize your, don't wait till your second baby. Like give it, you deserve it with your first baby. And if it's happened with your first baby, then definitely let's improve. Let's continue to do better. So, yeah,
Right.
I believe it. Let's see, Jocelyn. Do I have any other questions? I feel like you gave us so much information. It goes way past my questions. Yeah.
Well, something you had mentioned pain earlier, that people are fearful of pain. Fear has been shown to make laboring more difficult. So we have to do our best to prepare and try to address the fear. And the best way to do that is education. Knowing about birthing, understanding the process, understanding your options, understanding how to, move during delivery to help get baby down. All those things help you decrease your fear so that you can be more relaxed, using your breath and allowing for your body to do what it's supposed to do. And that's one of the reasons why I promote birth classes in general, birth classes with a medical provider, birth classes with a pelvic floor specialist to help you prepare for the expectations and the difficulties that will arise. Because it's not going to be a walk in the park, but if you prepare for being able to relax the pelvic floor while there is some type of pain simulation, then you're going to be ready. You're going to know what to expect. But if you show up unprepared for a group project, guess what? It's not going to be good.
Nope.
Get the education.
And you and I know the more you know about something that like is that you're fearful of, the more the less you're gonna fear it. Right? It's just that goes hand in hand. And so we tend to like, I'm scared of it, so I'm just gonna like put it off. I'm gonna be in denial. I'm going to push it away. Everything's gonna be fine. And then you get there. And maybe in your head, I always say that, like maybe in your head you're a chill person. You're like, I can get through anything. I'm at the hospital, it's fine. I'll be taken care of. And you're just like, I'm gonna keep that in my head and everything will be good. I trust my doctor. They're the professionals. What could I possibly tell them or no? And your body is like, no, this is not my house. This is medication. These are nurses that are talking over me and disregarding my cues, and they're just pushing me to do their plan. Your body knows, and your body is going to react, even if you consciously are like, no, I'm okay, everything's cool. And then that anxiety actually is subconscious, and everything tightens up. And then things get more painful than they really need to be. But you have to accept it, and you have to kind of let go of those control, even if it's subconscious, and just learn to use your breath and learn to ask the right questions and make sure that you have an understanding and that you're involved in your care, that you're getting proper informed consent. I know you are huge on that, and me too, just to be able to advocate for yourself and have people around you that can do that as well, to speak up and make sure you're not putting yourself into this toxic environment or this scary situation, that even if your head you're like, I'm okay, everything's cool, even as you're getting rolled to the OR, you're like, it's fine, I'm okay. You're not. You're going to be holding on to that, and it's going to be a tougher recovery, and it's going to be a mental challenge, and it can end up being a bit traumatic. These micro traumas happen to us as women, just losing our autonomy, which I can go on about all in itself. You know me, I'm just like so frustrating, but
Yeah.
learn, get knowledgeable, like, practice.
Yeah, body autonomy is so important, but especially in pregnancy. I feel like in pregnancy and in delivery, we lose some of that, and we lose it, or we kind of give it up some because I just want a healthy baby, And I get that. But you can make decisions that will not only make sure that your baby is healthy, but make sure that you are doing well on the other side as well.
Right. And as you said, we need to, with my issues and everything that we go through, like we got to put ourselves first right now. Um, we have to put our physical and mental and emotional health top priority. We cannot put it out. I know work is important. I know family and having fun is important. But like I tell my clients, I was like, you need to 30 minutes a day. 30 minutes a day, focus on learning about your body, about where your values are, about how birth works. Set yourself up with a wonderful birth plan, talk about it, take your classes, 30 minutes a day, as soon as you can, for as long as you can. Because I promise you, once that baby comes, it's going to be more than 30 minutes a day. But if you can prepare now, then it's going to be way more efficient once the baby comes. You're going to have more time to enjoy it, less regrets. But you have to prioritize yourself every single day.
It's super important. I had a patient who her birth wasn't what she had wanted. She carries a lot of tension in the pelvic floor. She ended up having to have a C-section, and that affected her relationship with that child, at least initially, and it affected her mental status. She had postpartum depression and postpartum anxiety, which she had acknowledged at the time, but is now really acknowledging that she still has some of that postpartum anxiety that's still affecting her pelvic floor. And the child is like 7 years old. So it's super important to, stay on top of your health and get the care before it becomes a problem.
100%. I had my baby, I was 20 years old, so that's 23 years ago. It wasn't until a few years ago that I even found out about PT and pelvic floor specialists. And I was a nurse for half of that time, and I had no idea. And then it wasn't until I started branching out and learning on my own that I started meeting pelvic floor specialists. I'm like, wait a minute. So I don't have to pee when I laugh? Like, that is this I was always told it was normal. And I'm a nurse. I was like, are you kidding me? And this was 20 years later. So I was like, oh, I can figure this out. I can fix this. And it wasn't until 10 years after my delivery that, oh no, longer, 17 years, because that's when I started nursing, that I went from the time I delivered to by the time I was in the labor and delivery unit, and I saw this isn't right. What I had experienced is actually affecting me 17 years ago. I thought it was normal. I thought everything that had happened in my first delivery was how it was supposed to be. And it wasn't until I was laboring with women and I saw, like, doesn't feel right. Wait, this is what happened to me. I had episiotomy, bright lights everywhere, loud people, so many people in the rooms, like talking over each other and yelling at me to breathe and counting, and it was too much. And I thought that was just how it was. And it wasn't until, and that's how I was trained. So I was doing it, and then it just like started hitting me like this is kind of awful. Oh wait, these women are crying at the end of their delivery. And then they're thanking us as they leave. Thank you so much for everything you do. Oh my gosh, I'm like, and I started feeling awful. Like, why they're thanking me, but I feel like I robbed them of something doesn't just feel right. These traumas, and people think of trauma like a C-section or something very physically traumatic, but it's more than that. And I'll stand on that soapbox like, no, no, no. There's these little traumas, and it starts with how you're spoken to, how you're listened to, how you are involved in your own care for your own body. My autonomy was gone. I had no say in what was going on with my body, from episiotomy to the position I was in to how I was cared for after, nothing. And that was that's normal. That's how it is. And I just had enough, I started having anxiety attacks walking into work. Like, I can't keep doing this. And then I was having confrontations every single shift, saying, stop it, like putting my hands over the mom to stop them. Like, stop, don't do this. Right? Listen to her. It was too much. And I'm like, I have to get out of here. And I'm still in there, right? But it's a whole different vibe. I found a hospital that is way better, and I'm still vocal about all of this, and they know that I'm coaching and training women to not accept this either, and to know that it's not normal. And I love meeting people like you, especially women out here that just get it and that are on the same mission and passion to just help each other. And I love talking to moms too. So thank you for everything you do. Yeah, any final words? Were we missing?
Any final words? I'll say what I normally say for anyone who is prenatal, which is always ask why. If they say you need 4 units of blah, 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 why? And negotiate if you don't like that answer. You can always, you know, get a better understanding of why things are happening and decide to not accept it, right? They only have to provide care if you're physically not doing well, right? Otherwise, if you're conscious, ask why. And if you're not happy with it, ask for what the risks and benefits are, and then make a decision, make an educated decision.
Exactly. For you and your baby. That you are the decider of your baby as well. And that could be very well to go with what the doctor says, but you still have a say to ask why. I love that. I love, love, love that. And ask for time if you don't like it. But you should be involved in that conversation. And why is the best question you can learn. If you can go with any little tool, it's why. Because an understanding will relieve fear, it will relieve some anxiety, it'll open up communication for everyone, for your partner, for your support team, for
Right.
yourself. I love it.
Yeah. It's going to build trust with that provider. If that provider is recommending this, and then at the end of that discussion you agree, then you're building trust.
1,000%. I love it. Wow. Thank you so much, Joselyn. It's been amazing. I think we mentioned the Instagram handle before, but give it to us again. Where can we find you and get more information?
On Instagram and on TikTok, it's the Pelvic Trainer.
Awesome. All right. This is Dr. Joselyn Rodriguez. Thank you again. And we will be chatting soon.
Thank you.
Thank you.
Thank you so much for joining us on this interview with Dr. Joselyn Rodriguez. And again, you can find her at The Pelvic Trainer on Instagram and Facebook and TikTok, or go to her website at www.jaept.com. And we look forward to seeing you again. Next week, we are going to jump into the current evidence around delayed cord clamping, cord blood banking, if you're interested or even heard of it, of collecting that cord blood and tissue, and why we may want to do that or why it's just maybe not for us. That's your decision, but let's get the evidence behind it and some data. And then I want to touch on cord blood milking. Have you heard of that one? Cord blood milking, and why you may want your doctor to know about it or wonder if your doctor does it in case your baby needs a little help after delivery, and how to get that cord blood to him fast, even if he's struggling during transition. And join me next week. Again, if you're interested in working with me, come visit me at myfriendsandnurse.com and contact me directly. And I'd love to get you part of my membership and a client. I have workshops every Sunday. The link is in the description notes. So join me for your birth plan, and we can work on that together. And I can give you all the inside secret tips to make sure your birth plan works. I don't care what's on your birth plan, but what if you can't make it work, right? It can't be a stereotype. And then, of course, we have our crash course coming up. We're going to be doing that monthly. So go to myfriendsandnurse.com/crash course to get your seats. I'll see you guys soon. Thank you for listening to My Friends and Nurse presents the Birthling Podcast. We hope you enjoyed today's episode and found it valuable. Before we go, a quick reminder. The information shared on this podcast is for educational purposes only and should not be considered medical advice. Always consult with your healthcare provider for any medical concerns or questions. If you enjoyed the episode, please subscribe, leave a review, and share it with your friends. Your support helps us reach more people and continue to bring you great content. Until next time, stay healthy and stay informed.